Welcome to Ask Sid, the official podcast for Sydenham Clinic, a clinic where luxury meets medicine. We are on a quest for longevity. And I am so thrilled to be your host on this show. My name is Anchal Bhatia. I am the founder and CEO of Sydenham Clinic and the author of Your Doctor is Not God and How to Be the CEO of Your Health. I look forward to taking this journey with all of you and having amazing thought leaders, guests, and members of our Sydenham team answering questions that you put forward. And I urge you, and I hope you will, ask Sid more questions on longevity, wellness, living to your highest potential. We are all trying to be the best versions of ourselves. And our physical, emotional, and mental health is foundational for us to achieve health and success in other realms of our life. So welcome to Ask Sid.
Hey guys, Dr. Adam Brittain here with Sydenham Clinic. So happy to be with you, and today I'm going to talk a little bit about stress. Yes, stress, that's right. There's good stress, right? And there's bad stress. There is such thing as good stress. So the bad stress, traffic, screaming kids, in-laws, all right, can be bad types of stress, stress that we're used to. This type of stress works in a whole different way than what I'm going to talk about today. This bad stress releases cortisol, massive amounts of cortisol from your adrenal glands, increases your blood pressure, increases your sugar levels, increases your truncal obesity, your truncal fat, your visceral fat, all the bad things we talk about in terms of metabolic health. So over time, these things add up. These bad stresses add up. So think about those bad stresses. And now I want to switch to good stress, right? What is good stress? Well, before I talk about good stress, I want to talk to you a little about how it fits into longevity. I talk all over the place on longevity, give lectures all over the country on longevity. And if I were to break it down into the simplest form, I'd say longevity is kind of a mathematical equation. Longevity equals the rate of cell turnover or new cell repair, new cell growth over the rate of inflammation, right? So if you think about growing older, the aging process is actually a chronic disease, right? Because the rate of inflammation increases as we get older. I often talk about an iceberg, analogy like an iceberg. Most of the iceberg is beneath the surface. This is your baseline level of inflammation. This is normal. This is needed, required inflammation for us to maintain our vitality. But once that iceberg gets above the surface of the water, those are your symptoms, right? That's the disease process presenting itself, right? So think about that analogy as we go through this. So we've got bad stress, and now I want to talk about good stress. Well, what does good stress do? Well, if we think about that equation, longevity equals the rate of cell turnover or rate of new cell growth over the rate of inflammation. Well, these good stresses increase that numerator, increase the rate of new cell turnover and new cell growth and repair, right? So we can do things to maintain that low level of inflammation. Good sleep hygiene, right? Good nutrition. Exercise can do that, certainly. Even moderate exercise, walking, meditation, things that will keep us at a low level of inflammation as we get. Now, think about when we're younger, our cells are turning over and repairing a lot easier than when we're getting older. So as we get older, this process kind of becomes more difficult. When we're younger, we don't have a lot of overall inflammation, so it's easy to maintain that level of longevity. As we get older, the rate of inflammation increases, right, obviously, and the rate of new cell turnover and repair actually slows down. So you can see how that equation kind of reverses itself and becomes kind of our enemy as we get older. So maintaining a good level of inflammation, nutrition, sleep hygiene, moderate exercise. But how do we increase that top number? How do we increase that autophagy? That's the term that I often use for cell turnover and new cell development and repair. Well, that's the good stress, right? The good stresses increase that level of autophagy. And that becomes so important as we get older because we have to kind of maintain that equation to maintain our longevity. If we maintain the longevity of our cells, each individual cell, we're made up of trillions of cells, and the cells are made up of tissues, and tissues make up the human being. So if we increase the longevity of the individual cell at the cellular level, that will increase our longevity as a human, right? So it's pretty straightforward. So good type of stress. Well, not traffic, not in-laws, not screaming kids, but stress that the body deems as life-threatening, life-altering. So think back in the caveman era, right? Why were they so healthy? They only lived into their 20s because they had animals eating them, right? They had no antibiotics, so a simple scrape on the knee, they'd die of septic shock, right? So why were they so healthy? Well, they had to exercise to eat, right? They couldn't eat without strenuous, vigorous exercise. If you've ever tried to hunt a large mammal without a rifle, it's quite difficult. It takes a lot of energy, it takes a lot of strength, it takes a lot of endurance. So they couldn't eat without exercising, right? They endured, tremendous temperature changes, extreme cold, extreme hot. They went months, not months, but weeks certainly without eating, all right? And that provided some kind of a calorie restrictive state, not unlike intermittent fasting that we talk about right now. So these types of things are survival types of ideas: temperature extremes, calorie restrictions, intense exercise. So I'm not talking about getting your steps in. I'm talking about VO2 max exercise, zone 2 level training for several minutes each day for several days. So pretty intense exercise. These types of things the body deems as fight or flight, survivable type things that you have to survive, right? These are not the stresses that that won't end your life. These are stresses that the body deems as you have to make some adjustments. Your body has to repair damaged cells. Your body has to produce new cells, autophagy, increase autophagy just to survive, right? So I talk about these things: infrared sauna, red light sauna. These types of things are different than normal heat exposures because the level of energy is so much greater. It penetrates the tissues deeper and it activates the cellular repair mechanism, okay? So that's why I talk about infrared and red light. Infrared is a slightly lower frequency. Infrared is slightly lower. Red light is slightly higher level of energy. So the red light goes a little bit deeper and promotes more cellular repair, right? So I talk about cold plunge. Right? I talk about cold plunge. These types of things, there's so many benefits to these things, but one of the main ones are things called heat shock and cold shock proteins, right? So extreme heat shock proteins; extreme cold shock proteins. These are proteins that help other proteins, enzymes, fragments of DNA stay in the right 3D configuration, right? With the day-to-day stress of life, these proteins become misfolded. A good example is Alzheimer's disease. The beta amyloid plaques and the neurofibrillary tangles that happen because of Alzheimer's are because of misfolding of proteins. That's one of the mechanisms. So these heat shock and cold shock proteins are released, and they maintain the proteins in the correct configuration and prevent this misfolding of the proteins. So that's the main way that these extreme temperatures can really help our cellular health, right? So we look at extreme exercise: increase cerebral blood flow, increase blood flow throughout the body, cardiovascular health. Also heat shock proteins, right? So if you're running or doing sprints in the heat, in the Texas heat, you're going to get a lot more benefit from these heat shock proteins than you would by exercising in a climate-controlled gym. So things to keep in mind in terms of the level we need to push our bodies to get to these extreme types of, is this a survivable type of circumstance for the body? And if the body deems it a life or death thing, it will increase that autophagy. It'll increase that new cell turnover and new cell development. And that will prolong our longevity, right? In Western culture, we're so used to pulling up to the drive-through, we don't park far enough away or on the second, third, fourth, or sixth floor to walk the stairs, right? We take the car to the valet. So if we think about some of the blue zones, right? What makes the blue zones so important and so to us to learn from, but also what makes them so successful in terms of living into their hundreds? Well, they're never sitting still, right? These folks in these communities are walking stairs. They're walking from camp to camp. There's a close sense of community. There are things that they're doing that we've lost track of here in a Western comfortable society. So maintaining that level of activity, maintaining good, healthy nutritional choices, community, good mental and emotional health, very, very important to these types of things as well, not just the new cell turnover. So if we think of longevity in that way, we can kind of understand how it works. Maintaining a low level of inflammation while increasing your body's ability to create new cells and new tissue is really what it's all about. Now, a lot of folks want stem cells. They want to do it kind of the artificial way. And those things are out there, certainly. But I think when you put the body in a stressful situation, in a good stressful situation like we've just talked about, you increase your natural stem cells, right? You increase your body's natural ability to release those stem cells from the bone marrow, from other tissues that are going to give you your natural stem cell infusion, right? So a lot of people want a quick fix, and I talk about longevity being a lifestyle, right? It's not a quick fix. It has to become entrenched in your lifestyle, and it has to be a day-to-day thing. And I know it's hard to do, but if you can just understand how the body responds to stress, bad stress. Oh my gosh, this is happening. I'm not in control of this. I can't get around this traffic. Cortisol, bad hormone. Releases a lot of sugar into the system, makes you more insulin resistant, increases your blood pressure, increases your fat content, your visceral fat. Good stress is more from a different part of the adrenal gland. It's called the adrenal medulla inside. It releases things like noradrenaline, epinephrine, norepinephrine. These things are fight or flight. In other words, life or death. It's a whole different system. Releases endorphins in the brain. It's a whole different cascading number of events that leads to new cell growth, new cell turnover, because the body has to survive. The body wants to survive, right? So these are things I want you to keep in mind, when we think about longevity, because it really comes down to that. And I talk to patients all the time about knowing your genetics. In my case, I've got 2 copies of ApoE4, so I'm at an extremely high risk of Alzheimer's. Although no Alzheimer's in the family, thank goodness. I probably have some protective genes. But knowing these things, you can make the changes to increase autophagy, increase new cell turnover and repair in the brain, right? To prevent, right, these types of things from developing. A lot of medications that are out there for a lot of diseases just treat the symptoms. Just treat the symptoms. You have, joint pain, we're going to treat the symptom. You have cognitive issues, we're going to treat the symptom by increasing your neurotransmitter levels. What we look at here is more, well, how do we go upstream from that? What's causing these things to happen? And let's attack the problem from that perspective. And that's what we're doing when we look at these types of natural types of things, diet, extreme temperatures, exercise, sometimes calorie restrictions. These are the things that are going to promote cellular health, right, way upstream from the symptoms. So knowing your risk factors, right, knowing your genetic predispositions is so important. And that's what we do here at Sydenham Clinic. We catch things early, we make changes early, and our patients benefit. So keep that in mind, big picture. Look at the societies that are very successful in terms of living into their hundreds. What are they doing? What are they doing? How are their bodies adapting? It's not like a virus. Viruses adapt to live longer inside their host, right? Unsuccessful viruses, like when the COVID virus first came out, unfortunately we had a lot of death from that. That's an unsuccessful virus because the virus kills its host, right? So not unlike a virus, we're trying to live longer, and our host is the world we live in. So to maximize that longevity, that health span, not just lifespan, but health span, living healthier longer, right? Think about these simple things we can do on a day-to-day basis. Park further away. Get your steps in. Maybe work on that intermittent fasting if that's something you want to try. Now, for some people, fasting is difficult if they're trying to, gain muscle mass. We all know that muscle mass and grip strength and things like that have a direct relationship with increased longevity. Sometimes it's harder to fast, but that may not be for everyone. But that's one of the things. Good sleep hygiene. Extreme environments, try the cold plunge if you can. It's very difficult a lot of times to do it, I understand that. but it took me a while to get into it. But once I did, it's changed my life. It's increased my health tremendously. Something else I want to mention about cold plunge that happens, a lot of talk recently about vagal nerve resetting the vagal nerve. Well, what does this mean? Well, the vagus nerve kind of exits the brainstem and comes along the carotids, down the esophagus, down to the GI tract. And we've all heard the term rest and digest. Whenever you eat, they always say don't go swimming after you eat, because what's happening is after you eat, all the blood flow is kind of going away from your muscles into your GI tract to help you digest all that food. So the vagus nerve kind of slows everything down, slows your heart rate down. So when I go from the infrared sauna to the cold plunge, my heart rate will go from 100, 110 down to like 35 or 40 within maybe 20 seconds. So that's the vagal nerve being just stimulated to a point where your body has almost pushed the reset button, right? You know, your phone kind of has a seizure. You turn your phone off to reset it, it turns back on, it's perfectly fine. That's kind of what the cold plunge does. It's kind of like a body reset. And it's hard to describe unless you do it. But whenever I do it, I get out of there, it feels like I'm walking on air. It feels like every cell in my body has been rejuvenated and repaired. And you just, the health benefits are just tremendous. So beyond the cold shock proteins, there's that vagal nerve stimulation. All of this fits in, though, guys, to putting the body in these good stressful situations, these good stresses that may initially seem life or death, right? But the body responds, right? The body is very resilient. It responds to these stresses by making new cells, repairing damaged cells, getting new mitochondria within your cell to increase the cellular energy production. So these things are happening at the cellular level way upstream, right, to things that we think are the main causes of some of these diseases. So if we really work on these things at the most basic level, we can have tremendous results. I see it every day with my patients. And that's kind of where we are right now, and that's what we focus on. But knowing the genetics, knowing your metabolic health, knowing your hormone levels, everything we do here with the testing is so integral and so important to know what your specific plan has to be. Each patient has a different plan, and we make those plans specific for you. So I hope you join us. Come by and see us. We're always here and available for you to discuss anything you want to talk about, and look forward to seeing you soon.